everybody. Welcome to Move Without Limits podcast. This is a live podcast. We don't edit, we don't record, we just go live. So there might be boo-boos, who knows? But today we're going to talk about a very common problem, neck and back pain. So your spine is very small. It's not meant to have a lot of pressure on it, go through a lot of force. So I'm going to talk first a little bit about the anatomy and why you might be getting neck and back pain, because the most important thing for you is getting the right diagnosis. So if you have a great exam, you go see somebody really, really good in their field, they're going to examine you from head to toe, no matter where your pain is, determine the cause of the pain, and then the cure, you will be able to find it and treat it. So let's go through just a little bit of anatomy. This happens to be a lumbar spine. So it has a lot of the same characteristics as the thoracic and the cervical, but the vertebrae are very differently shaped. So you have vertebrae, the bone, you have the disc in between, and you have the spinal cord going right through there, something we need to take care of. And you have spinal nerves as they exit the spinal cord at each level. So you can have pathology in the disc. So the disc is about 80% aqueous or water. And then surrounding the disc is a cartilage called the annulus. And with a lot of rotation over time, you can tear little fibers of that annulus. And as that tear occurs, then some of the disc material protrudes out. That's a herniated disc. Now, herniated disc can give you back pain, but it also can contribute to putting pressure on that little nerve root as it exits the cord, because that's where it herniates to. If it presses on that nerve, then it can give you pain down your leg in your lumbar spine in a specific pattern of whichever nerve it is. So it can be L3-4, that'll be down the front of your leg, L4-5 down the back or side, and L5-S1 down your leg and into your foot. So we can tell where you're getting this nerve impingement by your symptoms. Same in the neck. So if you have a nerve impingement at L5, then you might walk in and say, Kate, my shoulder hurts. It hurts right here, like right in here. Well, there's not a whole lot that can go wrong there. So we want to make sure we examine the neck and make sure that, because that C5 nerve root can refer pain down into the arm. Arm numbness, tingling, weakness, all is coming from your neck. It is not an arm problem. So that's why you have to determine what it is to make sure that you can treat it properly. Now, both in the neck and in the back, you have a joint. It's called the facet joint, and are these little joints that are in between each vertebrae. So there's a bone right here, and that attaches or rubs against the same bone. It's called the facet on the vertebrae below. It's got a little cartilage in between there, but if you wear that down, not unlike in your knee, then you're going to rub on the bony surfaces, and that's osteoarthritis in the spine, or it's sometimes called mechanical low back pain or stenosis, where you have limited movement. So mechanical low back pain is usually caused by either this problem in the facet, or there's specific curves that need to be in place and correct anatomy for your spine to operate correctly. Your neck should be curved in. Your thoracic spine curves out. Your lumbar spine curves in, and your sacrum curves out. So this and your neck both should have a little bit of a curve like that in it, concave. That way that you'll have normal forces on your spine, and you won't have abnormal forces on any of these important tissues like your disc or your nerves. Well, the problem is that everything we do is forward. So you turn your neck, you turn down, you read, you're forward, you bend over to talk to people or work, you're forward, all sports are played forward. So unless you do something specific to get this extension back, or this position back like that, or extension in your back, then you are going to have pain because your body does not like to be in flexion. There's specific things or positions that you do that increase the pressure on your back. So if you're standing, walking, you have about half your body weight of pressure on your spine, which your spine can handle. But if you sit, it goes up exponentially 3 times. If you bend over, it goes up 7 times. If you bend over with a weight, it goes up 9 times. If you bend over with a weight and you rotate, it goes up yet again. So think of all the sports you do where you bend over, like golf, and hit something, or tennis, or pickleball, or any sport, really. There's no sports you do in extension. So all those increase the pressure on your spine, and unless you do something to undo that or take the pressure off, then you're going to have problems in your spine. So that's a quick little anatomy lesson. But keep in mind that leg pain is often coming from your back, and arm pain is often coming from your neck. I had a friend once, we were walking on the beach, and she said, "Can I ask you a medical question?" I'm like, "Yeah, sure." She said, "Well, I don't really have any pain, but on this side, I can put my arm up like this and I can go like that. And on this side, when I attempt to do that, this is what happens, like nothing." And I thought, "Oh my gosh." She goes, "So do I have a problem in my elbow?" I said, "I don't think so." So I examined her, and she had the biggest herniation at C7, where it controls your tricep muscle, I've ever seen. And it was literally pushing against the spinal cord and bending the spinal cord. So I sent her to a very good spine surgeon, same findings, did an MRI, etc., and put her in a neck brace and said, "Go home and lay down and don't move." So she wouldn't sever her spinal cord. We operated on her the next day, took it out. She did therapy with me for maybe a month or 2, but after, even that same day when I went to see her after surgery, she started having some movement in her triceps, and within a month she had normal tricep strength and no problems. And this was, oh, I bet 20 years ago, and I know she still doesn't have any problems with it. So I guess what I'm trying to say there is that you really have to diagnose the problem correctly. Like, she had no idea. She thought she had an elbow problem. And the other thing is, seek help sooner than later. I tell people that if it's been more than a week, seek help. Don't wait. And seek help from somebody really good. Go to a really good doctor who is very good at whatever your challenge is. Go to a really good physical therapist, where it's 90% of problems, orthopedic problems, can be solved with physical therapy and conservative treatment. And also, don't just rest. I hear this a lot. Like, people say, "Well, I'm just going to rest it." Well, okay, fine. But your musculoskeletal system does not go back to normal just because you rest. I mean, it's kind of like a famous basketball player we know now. She rested for a month or a month and a half and came back and played, didn't get hit, didn't get in a big collision. Her pain came back because she just rested it. So nobody got to diagnose where that pain's coming from and treat it. So that's the biggest thing, is making sure we know what it is and get early treatment. Other things that affect, like your neck, is your desk setup. So ergonomics is really important. So when I go to somebody's office and look at a company, it's everybody's desk setup, or for you at home. Let me give you some tips about that and have somebody help you with this. So when you're sitting at your desk and you're looking forward and your neck's in neutral, that means straight ahead. You're not looking down, you're not looking up, straight ahead. If you take your computer screen and divide it into thirds, your eyes should be looking at the top third line. That's where you want to be, and that will keep your head in neutral. I had someone one day ask me to come look at her desk setup because she had really bad neck pain, this patient. And she had her desk set up here, but she was doing a lot of accounting with a lot of papers, and her papers were over here. So She was facing her computer because she had to look at her computer, but she had to look at the data. So she was sitting, looking body forward, but looking like this at her papers, like this all day long, and wondered why her neck hurt because she was holding her neck over there for, I don't know how many hours she did that. So we switched it all up so her papers could be right in front of her. We elevated her screen so she was looking straight ahead so she could look at her papers and her screen while keeping her head in neutral. So that's the first thing. And have someone, I tell people to have their significant other come and sit in your chair, have them put a little sticker where that top third line would be, and then take a ruler or a tape measure and draw a straight line from your eye and hit your screen. That's the best way to do it. Then make sure you sit in your chair, and when you sit in your chair, that your knees are slightly below your hips. Because if they're above your hips, it's going to put too much pressure on your SI joint and therefore your back. Your elbows should be bent at 90, and your wrists, when you're on your keyboard, should be in neutral. So they shouldn't be up here typing or down here typing. That will maybe lead to carpal tunnel or elbow problems. So right here, rest your arms at 90 and your wrists in neutral. I would, if your chair doesn't have it, maybe put a lumbar support in your chair in the back of it so you can help keep that concave position of your back. So those are the quick things you can do at home for your desk setup, but mainly most people aren't looking straight ahead and they're looking down. Or I think the worst thing you can do is work on a laptop because you have to look down. So get a secondary monitor, put it up, and type on your laptop on the bottom and look up at your screen in a good position. Posture is really important. Posture is a predisposing factor to having neck and back problems. I had this patient, oh my gosh, a million years ago, at least 40. He came in to my office, and I'm not exaggerating. He had neck pain. His neck was like this. I hope you can see that. It was so far forward. I'm surprised it didn't fall off his body. And he said, I've been to physical therapy, I've been to doctors, I've been to all these people, but nobody can fix my neck pain. I said, well, until we get your big bowling ball head back where it belongs, we're not going to fix your neck pain. So we got his head back, fixed his posture. Now, a lot of things have to happen to allow us to get that back. You have to mobilize his way up high in his head, mobilize his cervical vertebrae, strengthen all those upper body posture muscles that hold you upright against gravity, and a lot of exercises to glide his head, the bottom of your head, your occiput glides on C1, glide it back on that vertebrae, and then strengthen to keep yourself where it is. And it was successful, but not until you do all those things. So again, posture is, and I hate to hear parents and others say, stand up straight. Well, yes, they should, but kids today are like this, aren't they, on their phones and whatnot? So it's not just about standing up straight. It's about strengthening the muscles that hold you upright against gravity. So it's all those slow phasic postural muscles all down from your back. It's the back of your neck. It's the back of your shoulders. It's your shoulder blades. It's your back muscles. It's your glutes. It's your hamstrings. It's your calves. All that has to happen so your muscles can do their job and hold you upright against gravity. And then because everything we do is forward and flexion, I would spend a ton of time on a foam roller. We have a foam roller program on our website if you want to check that out, that goes through every single joint and every way of getting extension. In all my years of doing physical therapy, that is the only way I have found to get people back in extension. And just remember, everything you do is forward. So we got to undo that. So one note about what's great physical therapy. So if you have neck or back problems and you need to go to physical therapy, here's what great PT is and what not great PT is. When you first go to therapy, this is what we did in our clinic. We spent at least an hour with you the first time, and you got a thorough examination. So what does that entail? Taking a great history So once you take a really thorough history and you spend the time with the patient, you will probably get about 90% of your diagnosis if you've asked the right questions. Second, you have to do a really thorough orthopedic exam. So looking at their posture on all three planes, examining their motion, looking at their strength, looking at their joint mechanics, doing specific specialized tests to determine what the cause is. Then, and this is an important one that I don't hear happen a lot, then I would explain my findings to the patient. How about that? Like, get them on board. Like, tell them this is what I found. This is what's causing your pain. And then lay out the treatment plan. This is what we're going to do to fix it. And then manually treat them. You can't change the musculoskeletal system without getting your hands on them. And then I always give people a few exercises to do at home to maintain the gains I got, just a few. So let's say they came in with 50 degrees of forward flexion in their back, but we got them to 80. I'm going to give them a couple exercises to maintain that 80. So when they come in at 80, I can get them to 100. So just a few exercises. Then each physical therapy session, you reevaluate them and you progress your program. You don't do the same thing. You progress it as they progress. Physical therapy is not spending 5 minutes with the physical therapist and then getting shoved off to an aide or somebody else or by yourself and say, go do these exercises. That is not PT. So when people tell me this is what I had for physical therapy, I say, you didn't have it yet. So please find, it's usually going to be somebody in private practice. It's not going to be somebody that is owned by someone else and where maybe their motivation is not the best patient care. So please find somebody like that. If you need somebody, contact me. Because I do so much telemedicine around the world, that I have built up a really good resources of physical therapists. So chances are I can find you somebody. So comment on the podcast after. I look at all the comments, answer them, and I'll help you. But that's 90% of your back and neck pain can be solved by a good physical therapy exam and treatment. Surgery should be your last option, not your first. But we're going to bust some of those myths in a minute. But I hear that too much. People say, well, Kate, my back hurts and I think I'll just go have back surgery. That's not where you start. That's where you end. And lastly, your spine is made for motion. It's like all your synovial joints. It likes to move. It has fluid in it. It likes that fluid to move in and out. That's why your back or neck might be stiffer in the morning, because you have laid there immobile and those joints became stagnant. So what you want to do is, I just finished this. We did a whole 7-series video on back pain. And one of them was what to do before you get out of bed. So you want to make sure that you start with some easy, gentle motion in the morning after you've been stagnant all night. So questions about that we'll take during AKA. But I wanted to mention a couple of things that have come up for us over the last couple of weeks since our last live. People ask me all the time about working out. What should I do? Should I do Pilates? Should I do yoga? Should I do this? Should I do that? Well, personally, I think you should take my class, 50 Shades of Grace Functional Fitness class, because every class is different. We shock your body every single time. And it's going to be cardio. It's going to be strength. And after the age of 30, doing resistance training should be a non-negotiable. You have to strengthen your muscles. And here's the good news. You can continue to increase your muscle strength in your 50s, in your 60s, in your 70s, and even in your 80s. But if you don't do anything, I'll tell you right now, you are going to get weak. And I say this all the time. Your joints are only as good as the muscles that support them. So if you fall down, on your side, and your glutes should contract, absorb that fall, and you should be able to pop right up. If you are weak, you're going to fall, you're going to break something, and you're going to end up in the hospital. And 50% of people over 70 who fall and break something die. And the reason is they go in the hospital, they aren't moving at all. they get pneumonia and they die. So we always say friends don't let friends fall and break things. Friends don't let friends go to the emergency room. So muscle strengthening is very important. But there's a big difference between men's workouts and women's workouts. Men are built different. I mean, they have much more upper body and trunk strength. I've had women say, I go in the gym and watch these guys do these pull-ups all day long and I can't do them. Yeah, because you're not built that way. So ladies, don't mimic a man's workout. You want to have a workout designed for you specifically. It's just like treating patients. I've never treated in 40 plus years, I've never treated the same patient the same. Everyone's different. Everybody is so different and require unique and different treatment. You need unique and different exercises. So don't compare. The other thing is, I've had people tell me, I have such a hard time going to the gym and using that equipment. They're built for men. I mean, you sit in a big pec deck machine and you want to do this for your pecs, but you can't even get your arms in the pads because they're way out here. They're built for a 6 to 6'9" guy. So that's another reason why don't mimic what you see at the gym. And exercise machinery is very hard to use for a woman because they're not built for you. Plus, I'm not a huge, I mean, you can go in the gym and do some machines a little bit if you like that, but don't make that all your exercise because you're not walking around the world with a machine on your back. So you want to do functional exercises the way you live. That's what makes sense to me. The other thing is I'm amazed about is workout shoes. Most shoes are built on a men's last. And so they're not built for the way a woman's foot develops. Women's feet develop different than men because we develop different. Our pelvis widens for childbearing purposes, which changes the angles of our femur or your upper leg, which changes your lower bone, which changes your feet. Your feet are different than men's because you grow and develop differently. So women's shoes should be built on a women's last, not a men's. But 90% of shoes, there's only a couple shoe companies that actually have created a women's last. But what did they do to create women's shoes? They made them smaller and added some pink. So it's not really the best way. But speaking of that, here's the best way to find the best shoe for you. Well, there's certain shoes that are made for narrow feet, unlike mine are wide. So like Nike's built on a little more narrow last. New Balance, Hoka's, they're built on a little wider last. So when you go into the store, and a lot of people, salespeople don't like this, but do this anyway, go in there and look at all the shoes and pick out like 6 that you like and have them bring them all down and put one on your left foot and one on your right leg, a different one. So you have 2 different shoes on your feet. Walk around and go, ooh, the one on my right feels a lot better. Get rid of the one on the left. Then put a different one on your left and go, oh, this feels even better than that one. Get rid of the right. And keep going through that until you feel you've got the one that fits you best. If you wear any orthotics or inserts, bring those to the store and shove those in there and make sure they're big enough. I listened to, if you haven't listened to, this is a great book. Dawn Staley's book, the very, very well-known basketball player and coach. Her book is called Uncommon Favor. It's so good. And she has so many good lessons in there. But somebody said, well, what do you wish you would have done differently while you're playing? She said, I wish I would have bought my shoes bigger because my toes are like this now because they were in too small of a shoe. They were probably also a basketball shoe built for men that maybe there was a little pink on it. So choosing your shoes to take care of your feet. I don't know about you, but I don't know any other way to get off my feet. I can't walk on your hands. So you might as well get the shoes that fit you right and work on the ones that make sure that they feel good and walk around the store for a while. Don't just put them on for a second and go, oh, these are good. Walk around a bit. There are some shoe stores that let you run in them too. They even let you run outside. So experiment with that. Make sure you get the right footwear, especially for pickleball, because pickleball, the most common injuries to pickleball are in the calf and the feet. So tearing a calf muscle, tearing your Achilles tendon, and getting plantar fasciitis. Well, a lot of that is because people are not using the right shoe. So you got to pick the right shoe for pickleball that is a combination of cushion and a combination of stability. So make sure you do that before you go out and jump into that popular sport. So a couple common exercises for your neck. I'm going to show you these sitting, but I want you to do these lying down on your back, because I want you to take the weight of your big bowling ball head off your neck. So picture laying on your back. Then what I want you to do is bend backwards and go back and extend your neck, and then bring it back down, and then rotate it one way and opposite hand on opposite jaw, and give it a little push, gently, little push. And then we're going to go the other way and give it a little push. Then you're going to slide your ear to your same shoulder. Take your hand up over the top of your head in your opposite ear, wherever it is. Wait, sorry. This headphone's in my way. I'm going to drop over here. I'm going to take this hand up here, and I'm going to pull gently over. So now I've got a stretch right here. So side bending. Then I'm going to go the other way. I'm going to go over here. Take that same arm up over your ear and pull on that, and then come on up. And I would do all those at least 5-6 times in a row, and then always start and end with extension. You want to make sure that you restore that concave position of your neck and get rid of this flexion. Here's another great tip. If your neck is bothering you, besides getting really good physical therapy and good mobilization, take a towel, like maybe like a hand towel, and roll it up about this big, and lay down again. You're supine, you're laying down. Put this in the back of your neck. Whoopsie. Put this in the back of your neck. Lay on your bed and have the back of your head just slightly off the bed. So your head's drop down maybe this much off the bed. And your goal in that is to take the weight of your head off your neck while you've got the towel here, putting your neck in extension where it should be. If your neck's bothering you, do this several times a day. It will help, trust me. So there's a position you can get in to restore your neck curve, and some neck exercises. Make sure you do them on the floor. But the other important thing is strengthening, as I mentioned before, because you want to make sure all these muscles back here are very strong to hold your head and neck up against gravity. Now, your head weighs about 10 pounds, give or take. But as soon as you do this, drop it down, that's another 10 pounds, or another 10 pounds, or another 10 pounds. So gravity is going to keep hitting you in the back of the head, and it's going to strain your neck. So you want to make sure that all your muscles back here, those of you watching, are you sitting up straight with me now? Here, and hold your neck in neutral. Now for your back, as I mentioned before, extension is really the best exercise for your back. And the way to do that, a lot of you know what these are. So cat and camels, you get on your hands and knees, you bring your head up and sag. Again, this is on our back videos. Drop your back down, bring your head up, and then round your back, and then arch your back, and then round your back. And then press ups. It's not like the cobra in yoga, because it's more relaxed. You put your hands by your temples, you push down, you arch your back up, and you lower it back down to allow your back to sag. And again, foam roller, get a foam roller. And even if you just lay on the foam roller and do nothing else, but the exercises in our video are really good, that will get you into extension. So just laying on it. The foam roller needs to be the length of the long one. This one. Let's see. You see how long this is? This length. And when you put it vertically down your back, you should have about an inch overlap on your head and an inch at the bottom. You can't use the ones that are this short. doesn't work. And this is a diameter, and that's pretty much what everyone is. Now there's different firmnesses. So this black one is the firmest. Blue is kind of a medium firmness, and white is soft. So if you have a lot of pain and you're weak, you could start with the white one. But pretty soon you're going to need to get up to the blue one and then eventually the black one so you can get as much extension. Those white ones tend to collapse after a while. So, but boy, that foam roller, it's a great tool. So those are just some exercises. You can watch, do our class, you can watch our videos and get a lot more specific. I went through about an hour of foam roller exercises and went through how to get extension in your spine and then also how to open up every joint. So it's a really helpful tool. Like I said, in 40 years, I haven't found anything that is as helpful. So let's bust some myths now. You do not need an MRI before physical therapy or treatment. You do not. Unfortunately, today, the standard of care is going to the doctor's office. Well, let's get an MRI and see what's going on. Well, how about taking a history and doing a good exam? What happened to that? I mean, used to be the standard of care. I mean, I would think that would give them the most information, but unfortunately, they spend about 3 minutes with you and get an MRI. We have to understand that there's a very high level, 60 to 70% false positives, false negatives in MRIs. So you don't want to get an MRI, you don't want to make a decision on what to do with a patient based on an MRI because it could be wrong. I've been in a lot of surgeries where it said complete tear of these 3 things, and we get in there and they're not torn. Conversely, it says, well, could be, maybe, not inconsistent with, and we get in there and there's a whole bunch of things torn. So you really don't know unless you get in there and look, but you also don't need it. I recommend an MRI when the exam and symptoms and the patient's complaint doesn't match what I'm seeing. Or before you plan a surgical course, maybe you want to see what's happening at the level above and below, and that's important. And before maybe regenerative medicine injections to see what's going on in there. But as a matter of course, I've had last season, I was walking down to the pickleball courts. Somebody stopped me and said, hey, Kate, I hurt my shoulder. I'm going to go get an MRI. And I said, have you seen a doctor or a physical therapist and gotten an exam? No. So let's not start there. I mean, let's save you some time, maybe some money and energy, and start with conservative treatment with physical therapy. And then let's go on from there. There's a whole gamut of things that can happen prior to getting to something less conservative. Again, I mentioned this earlier, don't just rest. Rest is not going to return your musculoskeletal system to normal. You need physical therapy to do that. So just resting, let's say, well, I'm a runner and my back hurts and I'm going to rest for a few weeks. And then they go back out and run and it comes back. Well, let's fix it and get you on your way and so you can keep running. Other people say to me, well, I have pain because I'm aging. Well, not really. Aging is, again, your chronological age is just a number. It might not be where you are. Your body might be a lot younger than that. But what it really is, the pain is really coming from being under-muscled and deconditioned. So if you're someone near and dear to my family has been sitting in a chair doing nothing for maybe a year now, maybe longer, he has no core strength, he has no leg strength, and when he gets up, he falls often because he doesn't have strength. So it's not aging, it's decondition, and movement is medicine. So it's not just aging. So those are some of the myths that I've heard people say that I want to dispel. And I want to say one more thing before I get to our favorite segments. I want to mention a couple things about our great podcast that we had on peptides with Dr. Davis Francis. If you haven't seen it, Please go back and watch it. I know I've heard from some of you that it's a little scientific, throwing out all these numbers, BP 157, AG 157, alpha, beta, blah, 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 blah. But let me just tell you the main points. All peptides are not created equal. There are certain peptides that treat certain things, and you need that peptide for whether it's your gut or your thyroid or your thymus or your heart or whatever it is, you need that specific peptide. And that peptide and that dosage should be prescribed by a doctor who is doing great work with peptides, not selling out to companies that aren't good, but people who really know what they're doing, and he does. So you can always do a telemedicine with him if you're not in your area. 90% of peptides today are scams. I had someone contact me. I researched this for the last year and finally found somebody really good. And someone asked me to get involved in their company and said, these peptides are great, And I said, well, let me see. I looked at the bottle. They're vitamins. They're just vitamins. No peptides, no proteins, nothing in there. So be careful. Also, peptides really need to be administered with an injection sub-Q. It's not hard. You just kind of lift up, pull the skin away from the muscle and inject it. It's a teeny tiny needle, but that way you're getting the maximum dosage of peptides. If you take it orally, and let's say it's 100 milligrams of, and it's probably not a peptide, you may get 10 milligrams. So if I'm going to go through and the experiment of seeing whether these peptides work, I want to put the maximum in my body. So go back and look at Dr. Davis Francis's podcast, sift through the scientific stuff. I'm going to have him back on, actually. We're going to do a live with him, a Q&A, so get your questions ready. But he's very, very smart about which ones can help different diseases like diabetes or work on your organs, and also which ones can help you as an athlete, which ones can help you have maybe a little more endurance on the court. Maybe they help you recover better, but they're all not the same. And they need to be the right thing and from a reputable source. So seek that out if you're interested in peptides. Peptides are great, but we need to make sure that we do it right. Now, my second favorite segment is crazy things I see at the gym. And maybe you guys have done this, so let me just caution you. And I do see more guys do this than women, but y'all know what the big leg press sled is, where you sit back at an angle and you push your legs up against weight, right? So I saw this guy at the gym. So maybe the things you can put the weight on are only about like this long and probably can fit like 5 plates on each one. He put 5 plates on this side, 5 plates on this side. So I don't know how many hundreds of pounds he was pushing. And as he pushed at the end, he locked his knees out. And then he came back in and they pushed as hard as he could. And he locked his knees out. And you can go into hyperextension of your knee when you do that. And it is horrible for your knees. It is, I can't say anything at the gym, but it was it wasn't a crazy thing I saw at the gym. It was a potentially very harmful thing. So if you go to the gym and you do the leg press sled, do me a favor, do the weight you can do comfortably and push out and keep your knees slightly bent at the end, just slightly bent. Don't lock them out. There's something when you straighten your knee when you walk, it's called the screw home mechanism, and your tibia under your femur has to rotate a little bit to straighten your leg all the way. Well, when you do that against 700 pounds and you lock it out, you're creating a rotational instability in your knee. So don't do that. So that was a crazy thing I've seen more than once. So please do that and don't lock your knees all the way out. All right, I think we're ready for Ask Kate Anything. So questions that you guys have about this topic, anything I can help you with, I'm more than happy to. See if my lovely producer director has any questions.
Can you see that on the screen there? This is when you were talking about the neck exercises with the towel and the extension. Betsy would like to know, hold for how long on the neck with the towel and bed extension? Okay.
That's a good question. The question is how long, when I was showing the neck thing, how long do you lay there with it? Was that the question? So I would say minimum of 15 minutes, minimum. And somebody told me they did this too when I gave them this advice. They laid back with their head dropped off the bed with their towel there, reading. You can't do that. You have to relax. Relax all your neck muscles. Let your big bowling ball head drop away from your neck and relax. Like manifest something, meditate, listen to pretty music, listen to a podcast, listen to one of our podcasts. But please don't hold your arms up, because when you hold your arms up, you can't relax. So it's impossible. So great question. Thank you so much.
Why does my back go out suddenly when I bend or twist?
I love this question. Why does my back go out when I bend or twist suddenly? Well, it doesn't go out anywhere, like for dinner. What happens is that as I was talking earlier about having an annular tear. So here's the cartilage in here, you tear it and your fluid oozes out. Well, your body is so smart that it does not want you to tear that any bigger, to allow more disc material to pop out. So how does it protect you? It creates this spasm and this pain and tightens the muscles all around your back so you don't tear that cartilage anymore. That's what that is, that awful, quick, stabbing, I hurt my back, I can't move. That's why. It's not unlike spraining your ankle. So what happens when you sprain your ankle? It gets swollen, right? Why is that? Because it doesn't want that ligament to stretch out anymore. So it's a protective mechanism, just like that in your back and your neck. Same thing. Oh, my problem is this tight muscle in my neck. No, it's not. It's a reaction to what's inside, and we got to figure out what's inside to make sure that we get rid of it. So getting rid of that will make you feel better, but it won't get rid of the cause. So that's why your back goes out.
Scott wants to know if poor lifting form at the gym, like you were just talking about, causes long-term spine problems.
Scott wants to know if poor lifting at the gym causes long-term spine problems. Yes. Yes. It's amazing to me, the positions I see people in at the gym lifting heavy weight, like doing a big clean and press without their back supported, or doing a deadlift with their back rounded. I mean, things like that. So yeah, because why? It causes compression to this little vertebrae and their discs and all the soft tissue around it. So lifting poorly can, yes, give you spine problems over time. Now, there's nothing wrong with lifting heavy weights. Nothing wrong with that. I trained with some bodybuilders back in the day, and they were doing biceps with 100-pound dumbbells. And I just watched with amazement. But so that's okay. It's just that you have to do it right. So yes, it can be harmful.
Last question is, can neck pain cause headaches, dizziness, or shoulder pain?
Good question. What did you say?
Can neck pain
cause headaches,
dizziness,
and arm pain, shoulder pain? Mm-hmm. Yes, it can. A lot of things factor into headaches. A lot of them are mechanical. So like my dude that I treated a long time ago, when his neck was like that, he got a lot of headaches because his muscles in his neck were holding on for dear life, trying to get his head to come back. decreases blood circulation, decreases the increases the tension in all your neck muscles, so that can lead to a headache, can lead to dizziness. Also, neck problems can give you arm pain from your shoulder all the way down into your fingers. So yes, you can do that. The other thing, we'll have to do one on this, but I did my post physical therapy. I did one of my research projects in PT on the TMJ joint, the temporomandibular joint. The temporomandibular joint, because it's between the temporal and mandibular bone, it's a joint. It's a little round joint, and it glides, rolls, and it glides. A lot of times people with jaw problems can give you neck and headaches, neck pain and headache. So along with when someone comes into me with neck problems, I always look at their TMJ, and there's a lot of ways to evaluate that, whether that joint is working properly or not. So again, think of musculoskeletal problems as multifactorial. It's usually not one thing. So you got to go to somebody who's going to evaluate all of you and do a good job for you.
Sorry, there is one last question.
Oh, one more question.
Betsy, her left hand falls asleep when she's sleeping on her right side. Is that the neck or shoulder?
So your left hand falls asleep when you sleep on the right side.
Yeah.
So it's probably your neck. Things going to sleep, numbness, tingling is usually a nerve thing. Check your pillow, make sure it's not too high, because it really, when you lay down, you only want to take up the space between your head and your neck. It's probably that big. The other thing, I'm glad you asked this, see, that sometimes to support your neck and your pillow, I have people take a little towel roll like this and slide it in your pillowcase right where your neck is, whether it's on your back or your side. Either way, then your neck's going to be supported. I'm sure you know this, and I just went through this with our back series, is when you're on your side, you got to make sure you have a pillow between your knees and a pillow under your top arm. Because on your side, if you lay on your side and go night-night, your shoulder's going to roll forward, and it's going to close those holes and put pressure on your brachial plexus as all those nerves exit your neck. So in order to keep your shoulder in neutral, you put your arm up on a pillow right here and lay on your side. So now my shoulder is no different than it is right here with a pillow underneath. So try that. You may need some neck mobilization from a physical therapist, but that's typically what is the cause. Thank you all so much for your questions. There's one more. Don't want to leave anybody out.
Julie, can neck pain cause kink in back near scapula and chest pain?
Can neck pain
cause kink in your back near your scapula?
Kink in your back and pain near your scapula, your shoulder blade? For sure. Yeah. Because if your vertebrae are not all working together, then let's say you don't have all the extension in your neck and your inflection, and you have limited mobility in your neck. And you're moving and you're playing pickleball. So the rest of your vertebrae have to make up for that lack of motion. So now you're overusing something else. So that's what we call that is secondary substitution patterns. And so what happens, before you head out, I'd love your help. When you like, when you share, when you subscribe, it's not just a click, it's a gift. Every tap helps this message reach someone who may be sitting in pain, wondering if they'll ever move without limits again. So go ahead, hit that button now, and let's keep moving together.